Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
Hello, listeners. This is your host, Andy Curry, and today I am excited to have with me Dr. Michael Saxe. Now, Dr. Saxe is based out of Las Vegas. He has been a dentist, a pediatric dentist, since 1989, and he's also catering to special needs kids. He has written some articles on various subjects in the dental field, one of which was called Recognition of Child Abuse in the Dental Field. Doctor, welcome to our program.
Thank you for having me.
We're excited to have you here, and I appreciate you getting on the line. I know how you doctors can be busy with your patients and such. And the first thing that I want to ask you is to tell me about your education. Where did you go for schooling, and how did you end up in Las Vegas?
Okay. Well, I'm originally from Michigan. I moved in here from Michigan in 1981. My dad transferred out here to run a clothing chain. I attended high school and then completed my bachelor's degree at the University of Nevada, Las Vegas. From there, I went to Washington University in St. Louis, Missouri, and got my dental degree. And then from there, I went to University of Texas Health Science Center in San Antonio and got my certification as a pediatric dentist.
Now, what does it take to get a certification in pediatric dentistry versus not doing
regular dentistry?
Yes.
Yeah, basically it's 2 to 3 years additional training in the field. It includes hospital-based information as far as doing hospital cases, general anesthesia, patient workups, learning different syndromes that children have, genetic disorders, so you know how to treat all the different realms that may cross you.
Wow, that's really fascinating. I had no idea you'd have to go for further education on that. Yeah. Now, you wrote an article on recognition of child abuse in the dental field. Mm-hmm. Tell us about that article, what it entailed, and why you wrote it and that kind of thing.
Okay, well, basically it was published back in 91, and what it is basically is a survey for dentists when they suspect child abuse, to kind of give them a guideline of what information they need to get. As healthcare professionals, we are by law required, if we suspect child abuse, to report it, and we're protected by law if we report it, and it may not be true or not. But in order to, for the safety of the child, we don't want to take that risk. If we think there might be a chance of child abuse or neglect, it's best to report it and let the professionals deal with it and go through it. Child abuse is not uncommonly seen in dentistry. A lot of time a child who is abused are taken to different pediatricians each time so that the pediatricians won't pick up the pattern of child abuse. But when it comes to the dentist, they often make that mistake, thinking that every 6 months they go to the dentist, they're not going to notice it. But we look for different patterns of bruising in different stages of development. As far as aging, we look for things like bite marks and things like that. These are all things that are seen. There's also some oral cavity signs of child abuse that most people won't see, but when you do a dental exam, these signs can be picked up. So that's kind of what the article talks about, is what the things are to look for and then how to document your case of child abuse if you think you have one in your office.
How many cases have you seen since you've written that article? Do you know off the top of your head?
3 of them that I've reported in my own private practice and about 2 or 3 in institutional-based systems.
Doesn't that make you just so angry when you see that?
Yeah, of course it does. I mean, but again, a lot of kids are, I don't know if you call it, child abuse, but there's a lot more neglect that we detect than abuse. As far as neglect, I've probably reported 10 to 15 cases of that. But yeah, it's, my idea is that you're going to have a child, you need to be responsible for them and take care of them and do whatever you can to give them the best possible safe way of living. And not everybody feels that way. And unfortunately, if a parent gets on drugs or something like that, or someone else is watching their kid and they're just overwhelmed, these things can happen. So it's very important that the dentist understands that they need to keep an eye out for this. They may be the only ones that may see the signs of this, because again, they may not take them to the doctor regularly for to look at these types of things. They might just take them to the health district to get their vaccinations, and no one ever really assesses their entire body. When a child sits in my chair, I look at their arms, their legs, I ask them if they have any bruising. How did this happen? How did that happen? And I document that so that I know in the future if I see additional bruising in certain areas that I can ask, how did that happen? And if something doesn't sound right, I can make the decision if this is something I need reported or not, or at least question.
Interesting. And what if the parent is in there with you?
If the parent's in there with me, they shouldn't have any problems with the questions. If they start answering for the child, that's usually a sign that they're trying to hide something. So again, the article talks about different types of things. There's lots of articles published on recognition of child abuse, and it's something that every dentist should understand.
Well, kudos for you for doing that. I'm really glad to hear that. Now, when you're working on children, what's a common thing that you're doing besides, I'm sure it's checking for cavities, cleaning teeth and such, but what else are you helping them with?
Well, as a pediatric dentist, people always ask, what do you do different than a regular dentist? What we do is we deliver dentistry at a comfort level that's better for children, that they're not going to have fear and anxiety as they get older. Our goal as a pediatric dentist is to give dental care that will allow the child to continue into their adulthood without fear and anxiety. You have to look at how many people don't go to dentists because they have anxiety about it. Up to 40 to 50% of people don't go to the dentist because of their anxiety level.
Right.
If we can give a child a good experience from the beginning, and as they grow into adulthood, that anxiety level will not be there. Lots of times we have kids who would come from other offices who they had a bad experience, and now we have a harder job. Not only do we have to deliver good, safe, comfortable, relaxing services, but we also have to gain that kid's confidence back, get them back into the trend where they want to, go to the dentist and feel comfortable with it. We have lots of patients of ours that drive by the office because we're right across from a major shopping center, and they go, "Oh yeah, there's the dentist office. Are we going there soon?" Because they're happy to come. They come here, they enjoy it. We have a big waiting room where the kids can play and do things. We spend time, we enjoy ourselves with them. I had one just yesterday come in who loves Mickey Mouse, and I told the last time he was here, I told him I had a Mickey Mouse hat, and I put it on. And Mom says, "Oh, is Dr. Saxe going to come with his Mickey Mouse hat again?" Yeah, of course I did. Because our idea is to do whatever's going to make that kid comfortable, so the anxiety level of dentistry of another doctor they have to deal with is not going to be there in their system.
I would think that being a pediatric dentist would require a lot more patience than for doing adults in general. Is that true or not?
It does. And I kind of compare it this way, that anyone who deals with the elderly has the patience to be a pediatric dentist, because it's almost the same. The elderly are just like kids. As long as you don't hurt them and you keep them occupied, they're as happy as can be.
So what are some of your techniques when they come sit in your chair? You walk into the room, what do you do?
Well, first thing is when a patient comes into my office, I'm not paying attention to the parent. I want to win that child over. So when I first come in the room, I talk to the child first. That's my first person I talk to. "Hey, Johnny, how you doing? Nice to meet you. I'm Dr. Mike." And then I'll go to Mom or Dad and introduce myself to them. And then I'll talk about, if the kid's wearing, let's say, a superhero shirt or something. I'll say, "Oh, is he your favorite superhero?" "Oh, he's mine too." And, make a conversation. Don't even talk about teeth at first. You want to win them over and get them in a comfort level for them. Sometimes you walk into a room and a child is clinging down to a parent leg. You can't just take that child and start looking in their mouth.
Right.
You've got to win them over a little bit.
Right.
You've got to make them comfortable. And once that comfort level is there, it's going to last. And the next time they come back, it's going to be there. They're going to remember that, and it's going to be in their head. But if you just start, delivering services without making the child comfortable, I'm not doing anything different than anybody else can do. But that's what we're taught in pediatric dental residency. We do many different techniques. We do one that's called tell, show, do. You tell them, you show them, and then you do it. You just don't say, "Open your mouth, I want to stick something in their mouth." You can't do that with a kid. They have to understand what you're doing before you do it. So again, as a pediatric dentist, we're taught different techniques to win people over, make them comfortable. And then when the parent sees that we made the child comfortable, they get more comfortable too. Their anxiety level goes down. A lot of times the parents come in with their own anxiety, and they're already, "Are you going to give the kid a shot?" And, we don't use those terminology around the kids. That's not what we're here for. If we're going to clean their tooth out with a high-speed instrument, we don't call it a drill. We call it Whistling Willie. And the one that's slow-speed instrument, we call it Mr. Bouncy. We use laughing gas. We call it Mr. Nose. We use different terminology that kids can understand. If we're going to give an injection, we say we use nummy juice. We don't say we're going to give you a shot. We do things, we explain to them how it's going to feel to understand it, but we use terminology that the child's going to be comfortable with.
That's neat. That's really neat. So now you started in 1989, correct?
Yeah, I graduated dental school in '89, and then I went to Texas to practice for 2 years to get my certification.
Okay.
And then I came back in '91, back home to Vegas, and started practicing.
Okay, so you started in '91 in Vegas as a pediatric dentist.
As a pediatric dentist, correct.
Now with your 2 years of practice, I would imagine you were getting pretty good at getting a child comfortable. Would that be correct?
Say that one more time.
When you started your practice in Vegas, you've already had some practice before then, so I would imagine you were good at making a child comfortable.
Yeah. Again, I had 4 years of dental school and then 2 years in my specialty. So, I was pretty comfortable already dealing with children. I had no issues with that. Also, my older brother is a dentist, and my younger brother is a dentist. All three of us are dentists. So, that was the field that I choose. My older brother's an oral surgeon. My younger brother's also a pediatric dentist who works with me. So, again, giving good client services and giving back to my community was always our goal. It's always been my family's goal, too, to come back home and give back to, our community they gave to us. So, our skills were there. All our skills are there. And people know me for my reputation, and I go out of my way, to take care of their kids and make them comfortable.
Now, are you have you got to where you can just make pretty much any child comfortable and then you kind of dive into the work? Or are there just, 5% of the time or something like that where you go, oops, I got to back off and make them recomfortable?
Well, I can't make every child, come from the very beginning, but I'm going to go out of my way to do that. Sometimes we'll have a child just come in just to sit in the chair. I won't even look at him. I won't even touch him. And then have him come back a couple of weeks later, and then maybe I'll put the light on, or maybe pull out a mirror for him to look at. I have to desensitize them to get them comfortable. We also tell the parents, start bringing them in at an early age. We recommend 12 months of age, your first dental visit.
Oh, wow.
You bring them in every 6 months, and then by the time they're ready for their first cleaning or first x-rays, they've already been in that chair a few times. They've already met you a few times. They already know what the light does. You desensitize them, make them comfortable. So that's kind of, how pediatric dentistry is. It's getting them into a stage where they're able to get work done and be in the situation of having their mouth open and people in their mouth without them having anxiety and getting comfortable with it. But yeah, not every child can make comfortable. Sometimes, no matter what you do, you're just not able to do it. Sometimes we have to take kids to the hospital and put them under general anesthesia to get dental treatment done or even get an exam done. That's something that we do as well. So, again, there's other options, but I've never had a child that I haven't been able to treat, let's put it that way. Whether it be in the office or in the hospital, there's always a way to do that.
Well, it certainly sounds like you've got that down pat. What's one of the worst cases you had with a child that you had to fix? Every
tooth in their mouth bombed out, had it been restored. That's probably the word. That's about as bad as it can get. So.
Really?
Yeah.
Was that neglect?
That was neglect. Yeah. And then I've had another one that wasn't neglect. Well, it was neglect as well, too, but the kid had heart problems, and he had to have some major heart surgery. And fortunately, dental decay can affect the heart, so we had to get all the treatment. He had like 17 cavities. We had to get everything restored before he can have his dental surgery. Unfortunately, the teeth were so bad, we ended up pulling out almost every baby tooth in his mouth, which was very sad to have to do that. But again, we had to do that for the fact that we had to make sure his health is going to be good enough to have his heart surgery so he can live. You get another set of teeth, but you don't get another heart. So you do what you can to maintain that.
Boy, no kidding. Well, that's fascinating information, Doctor. Other than what I've asked you, is there anything you'd like to add to the conversation?
Well, again, pediatric dentists do lots of different things. Like I said before, I'm on the Southern Nevada Craniofacial team, which is responsible for evaluating patients with cleft lip and palate and craniofacial abnormalities. My older brother and I started that team about 17 years ago. It was the first team in Nevada, and it's been going strong ever since. These are, again, services that we provide. There's no charge for people to come to this. It's to help give them guidance, again, and giving back to our community to teach people what they can do for the best of their ability for their child to recover from whatever birth defect or anything that they may have. These are things that pediatric dentists do. Pediatric dentists are there to give the best possible care that's out there for your child. We are like the pediatricians of dentistry is what it comes down to. People take their young kids to pediatricians for their medical care. They don't take them to the family the family doctor when they're young like that. Well, that's what we are. We're the pediatricians of dentistry. And our goal as a pediatric dentist is to provide care to children of all ages at a comfort level that they'll be able to take when they leave us and be comfortable for the rest of their life with dental care. So that's our goal as a pediatric dentist.
Fascinating information. I had no idea the depth of that, and that was really interesting. Thank you for sharing that.
You're welcome. Nice speaking with you.
If someone wants to call you and get further information, what can they go to your website and or call you? How do they do that?
They can go to the website. It has a link to get directly to me, or they can call the office and get with me as well too. I'm also work at the UNLV School of Dental Medicine. They can contact there too to try to get in touch with me if they have any questions or want to have an appointment with me.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.